Are you wondering why nobody wants to talk to you? Or do you feel like everyone's keeping their distance from you? Hi guys and welcome to my channel. Today we'll talk about what causes bad breath and know when to consult your doctor. So let's jump right to the video. Okay, so the first cause of bad breath is what we call the morning breath. Every day that we wake up, we experience bad breath, and that is because every time we sleep, our saliva production decreases and no longer helps wash your teeth free of odor-causing bacteria, resulting in morning breath. And by the way, most of the bad breath-causing foods can be treated by brushing your teeth, gargling mouthwash, or overhauling your oral hygiene routine. Second on the list is when we eat certain food varieties. Remnants of food that stay in your mouth following a supper can cause terrible scent because of microscopic organisms' development. Sharp food sources, like garlic, onions, and a few flavors, influence your breath as they are processed and travel through your body. Third on our list is tobacco. Smoking cigarettes and stogies, and utilizing other tobacco items, leaves an unmistakable foul scent. Also, burning through tobacco items expands your danger of oral and different tumors. Fourth on our list is poor oral hygiene. When you skip brushing your teeth, flossing, and cleaning your tongue, you permit food particles to stay in your mouth. The bacterial breakdown of these remainders of food can cause foul scent. Furthermore, development of microbes expands your danger of gum infection. If by any chance that you utilize any dental apparatuses, like retainers or false teeth, clean them routinely. Remember to change your toothbrush every 3 months, or as suggested by your dental specialist. Okay, so before we go on to our countdown, are you wondering what other diseases you might get as a result of poor oral hygiene? Check out this video to learn more about it. So let's continue with our countdown. Fifth on our list is having a dry mouth. Saliva helps clean your mouth by gathering up food particles. In the event that there isn't sufficient saliva creation, food particles that may cause awful scent are left in your mouth. Insufficient intake of liquids will cause you a dry mouth and may indirectly cause terrible breath. But don't worry, because this can be treated by drinking water throughout the day, or you can invest in a dry mouth spray. Now that we know the causes of bad breath and how to treat it, we still have to ask ourselves this one very big question: what if brushing and doing proper oral hygiene doesn't work anymore? This is where we differentiate bad breath and halitosis. We can say that bad breath is caused by some foods that we put in our mouth, or sometimes because we have a poor oral hygiene routine. Whereas, halitosis is an underlying issue, or is something that causes bad breath that cannot be treated by simple brushing or your normal oral hygiene. And this is the time that you need to seek medical advice from a professional. First on our list is dry mouth due to medication. Xerostomia is a medical condition where your salivary glands don't produce enough saliva to keep your mouth wet. And as we mentioned earlier, the connection between saliva and bad breath, only this time, drinking liquids is not enough to treat the problem. Medicines that can cause xerostomia or dry mouth have an antiadrenergic or anticholinergic effect, which means they block certain functions of your body systems that help promote watery secretions from glands, like saliva. Here are some of the medications that can cause dry mouth. Alpha blockers and beta blockers, which is used to treat hypertension. Examples of which are enalapril and nifedipine. Antihistamines, which is used to treat allergies and asthma. Antidepressants, antipsychotic drugs, decongestants, muscle relaxants, appetite suppressants, diuretics, and many more. Some of the best ways to treat your dry mouth are as follows. Ask your doctor for an alternative medication. Always stay hydrated, chew a sugar-free gum, limit your caffeine intake, stop using products that has tobacco ingredient, use saliva substitute that contains xylitol or carboxymethylcellulose, use mouthwash twice a day. And by the way, I elaborated the medications that can cause dry mouth on my other video, so please check it out. Second on our list is certain illnesses. Postnasal drip is bodily fluid dropping from your nose down the rear of your throat. Nonetheless, when a postnasal trickle gets awkward, it could be an indication of a sinus disease, cold, or other ailment. You may likewise understand that your breath smells more awful than expected. Another illness is respiratory tract infections such as pneumonia or bronchitis. People with acute bronchitis are more likely to develop halitosis. This can occur when nasal congestion forces you to breathe through the mouth, enabling growth of bacteria on the tongue and mucous membranes. This bacteria may produce bad odor. Another illness is diabetes. In people with diabetes, high blood sugar levels increase glucose levels in saliva. This provides food for bacteria in the mouth and leads to the buildup of dental plaque. If plaque is not removed effectively, tooth decay and gum disease may occur, which also causes halitosis. Another illness is chronic acid reflux, also known as gastroesophageal reflux disease or GERD. Acid reflux is the backward flow of stomach contents such as undigested food, regurgitated bile, and stomach acids into your esophagus. This can lead to bad breath. The next disease rarely causes bad breath, but it's alarming because it could be a sign of oral, throat, or laryngeal cancer. Other signs include a lump in the neck, persistent ear pain, sores in the mouth that don't heal, difficulty eating, hoarseness, and unexplained weight loss. Last on our list is halitosis due to dieting, or keto breath. Whether you intend to go on a diet, or you often skip your meals, the outcome is the same: bad breath. If your diet includes low to no carbs at all, your body will undergo a process called ketosis. It's when your body starts burning fat and protein as your source of energy, instead of carbohydrates. Basically, when you are on a low-carbohydrate diet, the key to success is breaking fat into ketones to create ketosis, and as ketones get into urine and saliva, people who suffers ketosis describes it as having a metallic taste in their mouth and a smell that's sweet, fruity, or similar to nail polish remover. So the good news is that, if your breath stinks, you're probably doing a good job of sticking to that low-carb diet. While there are many ways to treat keto breath, like brushing, mouthwashing, or flossing, we still need to address the main problem, which is the low-carb diet. You may want to consider modifying your diet to avoid keto breath. And that's it for today's video. And if people still avoiding to talk to you after treating bad breath, maybe it's time to check your body odor, which I will cover on my future videos. So please support my channel by giving it a like, and if you find value on my videos, click the subscribe button and hit the bell icon, so you'll get notified every time I upload a new video. And together, let's all become a better well-being by being well. Thank you.